Hello, everyone, and welcome to another episode of the Latter Gay Stories podcast. A special episode. We are broadcasting live. It's usually when we have big news, an interesting story, or fun guests in studio only that we do a live broadcast. And unfortunately, we have big news. And for those of you who are joining us on this live broadcast, you probably saw some of our teaser videos and saw the news that we are talking about today. A little unsettling and interesting that we're having this discussion in 2022 around transgender issues at the Lord's University, Brigham Young University. For those of you who are just joining us and not aware of what's happening in Provo, yesterday was an interesting day at campus at BYU-Provo. But it didn't start just yesterday. This started about a month ago, and I want to kind of detail and outline what's going on at BYU with transgender students, on top of so many things that are happening in the news. In the dust storm of the Brad Wilcox controversy, we also have this topic that I think is super important, and that is the reason why we're doing a live broadcast today. We not only are going to discuss what's happening at BYU in Provo, but we also have brought in a few industry professionals as well, and I'll introduce those guests here in just a minute to talk about this topic. Um, but I wanted to give you an overview. So first off, thank you for those of you who are joining us. We appreciate you giving us a few minutes of your time to better understand this intersection, as we always say, the intersection of sexuality and reality, where it meets at LDS Street and LGBTQ Avenue. And in today's podcast episode, it literally meets at LDS Avenue and Cougar Boulevard. And that is what we'll be discussing today. So let us know where you are listening from. Always excited and interested to find out where everyone is tuning in from. We are broadcasting on our multiple channels. So if you are listening on our Facebook or YouTube channels, we invite you to use the chat feature. It is live and active, so we'll be able to have an interactive discussion. And throughout today's podcast episode, we will be taking your questions. I really want some of these industry professionals to be able to answer and field your questions as well. So if you do have some of those questions, please jump in and type them into the chat, and we will have that conversation. So as we teased a little earlier, a month ago, BYU administrators, and we'll discuss here in a minute who those administration officials are, found out that the Department of Communication Disorders, which is a department at BYU-Provo, was seeing and treating transgender patients in the Speech and Language Clinic. Now, the clinic has been seeing these transgender patients for almost 2 years, for a number of months, over 18 months, for, of all things, the innocuous speech therapy. And that'll be another aspect of what we want to discuss today in this episode, is exactly why there's such harm and danger in speech therapy at BYU. But once these BYU administrators found out or learned that the Communication Disorders Department, through the Speech and Language Clinic at BYU, was treating these transgender clients, patients, the clinical director, Lee Robinson, was told immediately to terminate their care. Now, this was over a month ago. Just the immediate reaction from the lower level staff, the clinical staff, the students who work in the clinic, um, they immediately defended their practice, and they appealed to the administrators and asked for clarification as to why they, as students who are training in, are being required or asked to not see a certain group or a certain clientele, which I think is an important point that we want to bring up in today's episode. So that's what we're going to talk about. We're going to talk about how BYU, then the administration at BYU, then reached out to those lower level departments, specifically in the speech and therapy, the Department of Communication Disorders, and asked them to stop serving a certain patient load. And they have cited the handbook. So for those of you who aren't familiar with the church's Handbook of Instructions. We want to go over that as well. We'll talk about that a little later in the podcast about what that looks like, maybe how the church is, and when I say church, BYU administrators are using the handbook as a shield to allow them through their religious exemption to provide discriminatory opportunities to some gender minorities at BYU. So, again, for those of you who are just tuning in and unfamiliar with what is going on at BYU, BYU has a speech and language clinic that is in the John Taylor building at on the BYU campus. This is a free clinic that offers these services to the general public, but essentially, this is similar to I don't want to compare it exactly to a um, like a beauty school, but in these campuses and at universities and trade schools throughout the world are clinics or beauty schools or hair schools or nail schools that are all set up to allow public individuals to come in and use those services at a free or reduced cost to give professionals in training an opportunity to um, develop and learn on the job training, essentially hands on. And the clinic at BYU is no different. The interesting part about what we're going to talk about today is how the university could come in and say, there is a certain clientele that we cannot allow you to serve, and that is the transgender community. Ultimately, what this resulted in was BYU administrators did instruct their clinicians to terminate the services, the patient services, to 3 transgender students at BYU-Provo. And we will discuss that today. So we do have 3 guests that we'll be bringing in into the conversation, 3 industry professionals. Many of you are familiar with them. The first who will be joining us a little later in our panel discussion is Dr. Lisa Hansen. She is a clinical director of Flourish Therapy, which is a behavioral clinic in Provo, Utah. Her clinic, Flourish, specializes in care for LGBTQ individuals and their family members. And Lisa is a graduate of BYU, so I think she has good insight because she is very familiar with the clinic. She also was the valedictorian of her class. She's a brilliant mind, and in my opinion, I've often called her the Mother Teresa of this intersection. So I'm a big fan of Lisa Hansen. She will be joining us in the broadcast a little bit later. RJ Rasueño is a licensed speech and language pathologist. And if I can stumble through this podcast with all of these speech therapists, I think I might be winning. He's also a PhD student in the Speech and Hearing Sciences program at ASU, Arizona State University. He was trained in gender affirming voice work in his master's program and has been providing those services to this population for more than 2 years. I think another cool part about RJ's story is that he also developed a program in collaboration with 2 other colleges to specialize in trans youth training and care, specifically in this topic, healthy voice and communication strategies. His program and work, along with that of those 2 other colleges, was given a national award for its efficacy. So super excited to have RJ as part of the broadcast as well. And last but definitely not least, Wendy Chase, a speech and language pathologist and clinical director at the Rocky Mountain University of Health Professions. She has been serving clients for more than 30 years with a focus on transgender and gender fluid care. And she has a great working relationship with BYU and specifically the speech and language clinic that we are discussing today. So those are our 3 panel guests that we'll be bringing into the broadcast here in a couple of minutes. But I did want to give you a little bit of just a brief overview of what this. I have no idea why my camera keeps cutting out, so we all just have to, I guess, somewhat deal with it. But at the BYU Clinic, the Communication and Disorder Department, often called the ComD, is a speech and language clinic. It is an outpatient clinic that is part of the academic experience that I just kind of described for these clinicians and university graduate students. And they're serving a variety of different clientele with a variety of different needs. Some of those that are handled at the BYU Clinic are cleft palate, stuttering, fluency, voice care, developmental language disorders, and a variety of other opportunities for them to learn hands-on. I talked a little bit about the structure of the clinicians, and I kind of wanted to go through that because as we start talking names and the way this laid out, the one thing that I did want to discuss that I thought was super important was that through the many people who reached out and said, we need to have this discussion. This is what's happening at BYU. Um, so many of the sources who came to me explaining and sharing their experience in this space wanted me to emphasize and reiterate that this was an upper administration decision. This decision wasn't made at a clinical level. This decision wasn't made at a department level. The people who were on the ground, the boots on the ground, those who have um, their work directly at this intersection were fighting for the transgender community, fighting for those non-binary, gender fluid, transgender patients that they were serving, and were, for all intents and purposes, they felt sideswiped and kind of deluged when this all came out. And so I just kind of wanted to give you an idea of the structure because we'll be talking about some names and how this works. But the clinical professor and director at the BYU Speech and Language Clinic is Dr. Lee Robinson. Um, Dr. Robinson reports to the chair of the ComD department, the Communication Disorders Department, which is under this umbrella of BYU's David O. McKay School of Education. The next in line there is an assistant to the office of the academic vice president. That assistant is Tom Patterson. Tom Patterson works directly with Shane Reese, and Shane Reese is the vice president of the academic department. When there is an issue or an administration issue, Shane is the go-to person who is essentially the liaison to the BYU president, which currently we know is Kevin Worthen, who has been mentioned many times, often as recently as BYU's Elder Holland's speech at BYU. And then there is a board of directors, a board of trustees for BYU, and that is the first presidency and the quorum of the 12. So those 15 men are the ones who finally make decisions for the university. Interestingly, I think it's probably worth noting that when Elder Holland spoke at BYU recently, the Muscat talk that so many of you are familiar with, he did say, and I thought this was an important thing to bring up in this episode, that there's not a ream of paper or a vehicle purchased at BYU without the board of trustees being aware of and making or authorizing decisions like that. And as I listened to Elder Holland speak about the influence that the board of trustees has, and then as I listened to the many stories of people who were reporting this transgender issue at BYU, I just thought, I think it's important that we know that in this case, when we're talking about administration, we really are talking about the President Worthen, the general authorities as trustees of BYU, that upper crust of the church who, and we'll talk about this a little later, who are trying to defend the church at all costs. So that's kind of the structure. That's kind of what we're going to talk about. We do want to bring in your questions as well. So if you are joining us, please add them into the chat and we will invite our guests to discuss that. So without further ado, we're going to welcome our guests into Wendy, RJ, thank you first and foremost for joining us, for taking a little time out of your day to share a little bit about your story and how you have met or been met at this intersection. Let's first start with you, RJ, and only because I want to talk to Wendy about her direct influence with the department and this particular topic. But first, RJ, tell us a little bit about yourself, a little bit about the program, and you're serving this population directly. So maybe tell our listeners why speech therapy exists and why a transgender client would see a need for this type of service.
Yeah, so, my story really does start in graduate school. It was a number of years ago that I was in a similar position that these graduate students are in now, where I was given a rotation at Arizona State University's gender affirming voice clinic. And I didn't really know much about the service. I just knew it was an opportunity. They were clients I was going to see. And Kyle, it was a game-changing experience for me. I mean, clearly, my life took a different route clinically, because when I worked with these clients, I came to see just how important our voice is to who we are as individuals. And these trans and gender non-conforming individuals, and Wendy, please chime in as you feel inclined, but these clients who come to us, it's not that all transgender non-conforming individuals come to see us. It's not a requirement. We aren't gatekeepers. It's quite simply when an individual's gender identity does not match the voice that they are using to communicate. And so for a period of time, and for me, it's about, depending on the client, I usually tell my clients it's about 10 to 20 weeks, more or less, that I see them. It's not a long time. I try not to be with them for, it's not a lifelong process. It's really just a time where I can give them the tools for them to be successful in communicating their voice. And the reason why speech language pathologists are at such a niche area and are so qualified to do this is because, we work with voice disorders. And so we're able to see the signs of possible, muscle tension, or things that, when these clients are, let's say that they don't see a speech therapist and they're trying to raise the pitch of their voice, they may strain their muscles a little bit, or, they may do some things that may put their voice at harm. And so as speech language pathologists, we have the ability during evaluations and as we're seeing them to really kind of, have that extra knowledge to do some preventative work. Or, I've had clients who have needed some extra, voice therapy that wasn't necessarily what they were coming in for, but I found that they'd strained their voice a little bit and trying to make these changes on their own. And so as speech language pathologists, we have this really cool opportunity to support these individuals and really to help them just feel more confident in who they are, feel more comfortable, and to empower them. And so, after just to give the audience members more of kind of what happens in the background, and Wendy, again, please chime in. As I was doing this, I asked my clinical supervisor at the time. I said, Myra, how many people do we have on our wait list? Excuse me. And our wait list was 1.5 years long. This is in Phoenix, Arizona. And I said, oh my gosh, like, what can I do? What can be done? And that was where this journey was born with my supervisor, Myra Shotsky, and with a graduate student social worker at the time, Jonas Spector, who's also trans. We developed this 3-hour training on healthy voice and communication strategies for trans youth, and that's trans and gender nonconforming, gender fluid youth, and their caregivers. And it was during COVID-19, but we were able to do it virtually. And it was this great pilot voice webinar that showed really promising results on how, just a 3-hour training can really give people more knowledge that really isn't super accessible, because, as we can tell with this example, there are, gosh, I had some data pulled up, but I think it's, one study done in 2017 that surveyed over 10,000 transgender individuals found that 20% of the respondents said that they were turned away from their medical providers, and even 50% reported having to teach their own medical providers about their experiences as trans individuals. So that's my long story about this, and just why speech language pathologists are, so qualified to do this, and why I have so much joy doing this.
I love it. Thank you, RJ, and thank you for the work that you do. Um, Wendy, tell us a little bit about not only your services, your background, but also specifically about this clinic and your relationship
Mhm.
with the speech and language clinic at BYU.
Well, I think to start out, my experience as a speech pathologist came late in my career in terms of working with this population. I was formerly employed at the University of Connecticut and started a program there because we had a pretty large community that was requesting services. And so we said, all right, let's figure out how to do this. And we put in some time and work to establish some services that were evidence-based and that we felt really good about. We saw many, many people. But what's been interesting is how I've seen it evolve in terms of the way that we approach treatment with individuals and the fact that there's so much more research related to what we're doing. And I think as speech pathologists, we're such good consumers of evidence-based practice and looking at ways to incorporate the best of things into the treatments that we provide, regardless of the type of client, that it really pays to see a speech pathologist to work in this arena because it is evolving in so many ways. When I moved to Provo about 4.5 years ago, I honestly thought that I wouldn't have the opportunity to continue this kind of work. I figured I would work with some of my other specialty areas and do all teaching and so on that I do in this job. And I didn't think that there would be a large community. I made one meeting with in circle and the floodgates opened. We have seen almost 50 clients in this clinic in the last 4 years, which is a pretty large number in this community. And there are so many people that continue to express how much they need the service. In terms of my students here at this clinic, it's the perfect opportunity to reinforce to them how to adapt to someone's personal culture, how to be respectful and humble about differences that people have, how to act professionally, how to consider ethical practice. It's been a real joy to watch the students embrace the learning. And I think we need more and more universities to continue to develop services so that we are turning speech pathologists from anywhere who can work effectively with this population. So I've been thrilled with our clinic. I've been thrilled that we've been able to meet a need here in the Provo area in particular. I look forward to continuing to develop more and more types of programs that we can do to support the community. And I think in terms of both the University of Utah and BYU and Utah State, to some degree, we are the programs in this state. We have to work together to support communities of all types. And we do that. We belong to groups where we talk to one another and we support what are happening in the different clinics and we argue about things and we talk about how we're dealing with pandemics and all those kinds of things. And so when the BYU Clinic was faced with this situation, they reached out to the University of Utah and to myself because we have clinics that can help transition these clients over to our services to support in any way that we can. And so I think in terms of a speech community, I'm always happy to be part of a profession that really is smaller than people think. You know each other, you are willing to do the things you need to do. And most speech pathologists, not that I'm bragging or anything, are pretty nice people. So always willing to help each other out. And I think that's what we need to do as human beings. We need to do the right thing and we need to help each other out. So that's kind of how I got involved in this conversation in particular.
Thank you. And again, thank you both for your work. I want to maybe give our audience maybe a Robert Frost, the road not taken or less traveled opportunity to better understand why, maybe first to the BYU clinician who, not given an opportunity to serve this clientele, maybe each of you give your opinion as to whether or not that is a good look or a good opportunity for that clinician after they leave BYU and enter into practice. So I want to discuss just a little bit of maybe the disadvantage, this decision, telling the clinicians at the BYU clinic that they're not transgender clients at BYU. So I want your opinion and just kind of give the audience what you think, or essentially your opinion as to whether or not that puts those future clinicians at a disadvantage among other professional providers as they graduate and leave BYU and enter into the industry. And then also, I want to try to give the audience an understanding as to the benefit to the transgender client as a result of these services, and what you've seen individually through the work. Maybe some case studies that show, or stories that you know of people who successfully were benefited through this type of service. RJ, you want to go first?
I mean, I was recently in grad school, so I could speak to, the disadvantages of it. I mean, I was thinking about this earlier, and when I was in grad school, Kyle, I think I saw like max 4 or 5 clients a week in the clinic. Like Wendy was saying, it gives you the chance to like dive super deep into the research. I mean, I still do now, but back then, you spent hours on lesson plans, you debrief with your clinical supervisor. I mean, these like these few clients are like your babies, and you just spend so much time immersed in the research and learning about the cultures and so much about it. And then when you get into the real world, heck, I see like, at least when I was a practicing speech pathologist, I was seeing 7 clients a day. And so that gives you such little time to delve into the research and to learn things. And, especially for this niche area, whenever you don't learn in graduate school, you have to pay money in CEUs and continuing ed units, and that costs more money. And so there are so many more barriers once you leave graduate school to really learning the material and learning about working with different communities and different populations. And so I see this as a great disadvantage to these students, because they're going to encounter these clients, these patients in medical setting, in the school setting, and good luck responding in person, like, in real time, right? Whereas at least in graduate school, I mean, I'm so grateful to people like Wendy, to these clinical supervisors who are able to, prep them before, help them during, help them after. Like, they've so much more what we call scaffolded instruction, little help, they can help them little by little to get where they need to be. And so that's what I would consider to be the biggest disadvantages to these graduate students.
I think, Kyle, from my perspective, there is a disadvantage. From a university perspective, there will always be populations. Our scope of practice in speech pathology continues to evolve and grow. It gets bigger and bigger. We're having big debates in our profession about whether or not entry-level education needs to change dramatically in order to prepare people, et cetera. We can't teach everything. But just exposure alone makes such a difference in your willingness to explore it deeper, even if that happens after you graduate. And so I think that level of exposure, introduction to populations when you're in graduate school makes a big difference in how you approach further problems. So we need to do a good job teaching people how to problem solve and research information, but you've got to open a door to that. And you do that through introducing lots of different ideas, lots of different options, and helping clinicians learn how to adapt the information they do know to a new problem and apply that forward. And I think that BYU, just like every other university, does a great job of that overall. But there's probably an opportunity missed if their students don't get to open the door a little bit. But that's an opinion, and I have an awful lot of respect for what BYU is doing with their program overall. So I don't want to cast any dispersion whatsoever on their program in general of preparing students for practice. But in this area, yep, it's a missed opportunity. For sure.
So for those of you who are just joining us and trying to kind of cobble together what has happened, 18 months ago, the BYU Clinic, the speech and language clinic at the Brigham Young University Provo campus, started seeing transgender clients for speech therapy, which is what we've been discussing in this podcast episode. About a month ago, the clinical director at the clinic at BYU was informed by administration that they found out that those transgender members, and I do say members, they were students at BYU, were being treated as patients at the clinic, and that had to cease immediately. the administration asked the clinical director to terminate those services immediately. The student level, and I would even say some administrators, were interested in how the BYU administration was willing or able to come up to the conclusion that the transgender person isn't able to receive care at BYU in their clinic. And that caused a little bit of discussion, which lasted about a month. The initial meeting at BYU among these clinicians took place on the 10th of January of this year. And a month later, which took us just less than a month later, which took us to yesterday, the clinicians had to inform 3 of those transgender clients, which I have believe, according to my sources, were all of the patients that were being served in the clinic, informed all of them that they were no longer welcome at the clinic and they needed to find new providers outside of BYU. That caused some obvious contention and issues within the clinical staff, the student staff at BYU. The overwhelming majority who was concerned about this type of a move. So I thought that it would be important to be able to have this discussion and maybe shed a little light onto this topic, because on its face and even down to its roots, this seems really unfair. And this seems like it puts the students at BYU who are training to become future clinicians at a disadvantage in terms of being able to work with a variety of different people within the population. I also think this kind of gives a black eye to BYU as an institution in terms of sometimes we say radical inclusion, but radical exclusion or discrimination. So for those of you who are just joining us, that is what we're discussing now. And the site that the administration of BYU claims as the reason for this is the Church Handbook of Instructions. And I want to talk about that in just a couple of minutes and kind of go through the Church Handbook of Instructions to outline why the church feels like this was the remedy or this was the route that they needed to go. But first, before we jump into that, we do have 3 clinicians that are with us on this episode. RJ Rasueño, Wendy Chase, and Lisa Hansen will also be joining us here in a few minutes. So while we have them, I do want to kind of pick their brain. But the Church's Handbook of Instructions talks about hormone replacement therapy, and I want to get to that in just a minute. But before I do, I just want to give the audience an idea from your perspectives as clinicians in this space about the permanent nature in terms of, so maybe this is a leading question, but we'll talk a little bit about the language within the Handbook of Instructions, which prevents or doesn't want to acknowledge or make an opportunity for a transgender Latter-day Saint to have a surgery or something that would change their gender or gender identity permanently. And so I don't want to open this up to say what you're doing is not permanent, but maybe discuss a little bit about the differences between speech therapy and something like a top or bottom surgery in terms of overall change or overall, I don't know what the word I'm trying to look for.
Wendy, why don't you start on this one?
Yeah, I'd like to throw a comment out there, though, before we get started on this particular question, and that's that the Human Genome Project in the United States recognizes 25 variants on gender chromosomes. It is scientifically not correct to say that there are only 2 genders. There are a number of variants. So the idea that making a transition such as this sometime after assigned at birth as a particular gender is changing things doesn't always sit. In fact, perhaps we need to look at this as adopting what should have been from the beginning but wasn't recognized. Because unless there is an obvious physical component to that particular variation, it may not be recognized as a variant. And I think that that's kind of important. That what's below the surface is not always what it seems on the surface. In terms of speech therapy and what we do, what we're doing, we see many more trans feminine individuals than trans masculine, although I do see both. And part of that is because if you go through hormone replacement therapy and for female hormones, you can't, and you've already been through male hormone changes through puberty, things get bigger, change shape, extend, etc. within your anatomy. That's what happens when you go through male puberty. Even if you start taking female hormones, that doesn't change. It doesn't go back. It doesn't shrink again. It doesn't change in its proportion, etc. And so what we need to do is ask this anatomy, the way that it is, to work differently, to operate according to a different set of rules, and to do that in a safe and effective manner. So it's behavioral. We are training a new behavior, a way to use muscles and ligaments and cartilages a little bit differently to produce a different effect. That in and of itself is inherently reversible. Not sure, not sure what else I want to say about that. Go ahead, RJ.
I was going to add a comment. First of all, Wendy, 100%, we're on the same page, which is great. It means we're reading the same research. But the comment about surgery, Kyle, as a speech language pathologist, I only this is very vulnerable information. And I recognize that when I'm seeing my clients, I let them know before I start. I say, I'm going to ask questions that may possibly impact our intervention sessions. I usually say from the waist up, or not even the waist, sorry, but from the lungs up, essentially, if it's going to affect our ability to breathe, if it's going to affect our ability to speak, then I will ask about that. But I try to ask only the stuff that pertains to me. And behind every question, I ask myself, how is this going to inform my clinical practice? Because let's face it, there are other clients we see, they may be doing other stuff. I don't care. It doesn't impact me as a speech therapist. And so, and even when I ask these questions, I tell them if you don't feel comfortable responding to this, just let me know. And so in terms of looking at, these permanent surgeries and stuff like that, I'm here to help my clients feel comfortable in their own voice. And that's at the end of the day, my job as a speech language pathologist, full stop.
And I think RJ can probably support this, but we have so many stories about people for whom this clinic or this type of service is the first time they truly feel accepted, that they are able to explore how they can communicate, that they can talk about things very specifically and leave the clinic in better shape to face what's happening out in the community than before they came in. I've worked with a number of individuals from the very beginning of their transition through to their presentation in their communities. And if you want a really interesting story, the very first airline pilot at United Airlines was mine, who went through the entire process of transition. And we knew that individual by one name and one presentation when we started. And our clinic was the very first place that individual was able to show up dressed and behaving as though they were the person they wanted to be. And that is just an incredibly powerful place to be as a therapist.
Yeah, I think that's I think that is the essence of why something like this is so important to this to the transgender population, gender non-binary, gender fluid population. It really is the three-ring circus of this podcast to let people know that they're not alone, they're not broken, and that their best days are ahead. And even having clinicians who can validate their experience and allow them to thrive in their own skin is part of that unbrokenness, is part of that opportunity of letting them know that they're not alone, and that there's a whole community of people out there who will support them. All right, because this particular topic, and I know nobody loves to wade in the weeds, especially you, Wendy, who works directly across the street from BYU, almost literally. But
I
they've
have
used,
nothing bad to say about BYU, by the way. Nothing at all. We love the program. They do a fabulous job. I just don't think it's a good idea that they have to turn these people out to other sources, and that's a shame. But that is the only issue
no, and
that I have. So
yeah, I can agree and side with that 100%. But at the end of the day, BYU administrators are using the Handbook of Instructions as the gospel here. They're using it as the yardstick to determine whether or not transgender clients should be seen at a BYU clinic. And so I just wanted to read through this and maybe get your reactions. Some of these I think you have already answered, but for the listening audience, I think it's important to see that over the last couple of years, but more specifically last year, the church did update the Handbook of Instructions and added a section specifically for its transgender population, transgender Latter-day Saint. Interestingly enough, so for those of you who do want to look this up and research this, because I think this is mind-blowing, that the conclusions that the BYU administrators came to were directly from this section that I'm going to read. And I just think it's mind-boggling and mind-blowing because the things that you both as clinicians have talked about today are directly contrary to what the handbook says in terms of if we're looking at this in relation to help versus hurt. What you're doing is helping so much. And interestingly enough, the very first paragraph in section 38.6.23 of the LDS Handbook says transgender individuals face complex challenges. That we can all agree on. Members and non-members who identify as transgender and their family and friends should be treated with sensitivity, kindness, compassion, and an abundance of Christ-like love. Now, just given what we've heard and seen at BYU over the last 30 days, and particularly yesterday, what does that say about being treated with sensitivity, kindness, compassion, and abundance of Christ-like love? Any of you want to wade into that? Come on.
do we want to wade into that? No. I will say that everyone gets to define for themselves what they feel is compassion. What are the borders of Christ-like love in their world? And if people choose to define it very narrowly, I feel badly for them, and they have that right to do that. I don't agree, but they have the right to do that. Yeah, that's about as far as I can wade into that one.
Wendy, you're really good at this. You're really good at these answers. I mean, I feel like my face says it all. So, yeah, it speaks for itself.
The second part of the handbook says church leaders counsel against elective medical or surgical intervention for the purpose of attempting to transition to the opposite gender of a person's biological sex at birth, which they've labeled sex reassignment. Leaders advise that taking these actions will cause for church membership restrictions. I kind of set this up for this reason. I wanted you to explain voice and speech therapy, mainly for the audience to understand and get an idea as to whether or not voice therapy is a surgical process. Does that fall within, in your opinions, anything that you're doing at your clinics and anything that you're aware of at the BYU clinic in terms of voice therapy, does it fall into that category of being an elective medical or surgical intervention? Is there any elective surgical or medical intervention that would have taken place at the BYU clinic that you're aware of, or at any other clinic in terms of speech therapy?
Wendy,
That's a
go ahead
loaded
on this
question.
one. Oh, yeah.
And
That's a
sometimes
loaded
really good
question.
at those.
I am also, yeah, I am also going to say that I am having a Wi-Fi delay here, so I apologize if I've missed some of the words. But you can again define elective however you like. But if someone is afraid for their safety, afraid that they will be set upon, ostracized, or physically harmed because of a quality that they have with their voice, then that to me is not something that's elective to change. That's necessary. It is protective. It is medically relevant. It's something that needs to happen. So much of what we do in this field has to do with giving people the power to advocate for themselves, to demonstrate self-efficacy, and to live the life that they can best live, whether it's because they've had a stroke or Parkinson's disease or cerebral palsy or whatever it is. That's what we're trying to do. And I don't see how this is any different.
RJ.
I 100% agree with Wendy, and I think that the only my one comment to that policy, Kyle, if that's the right term, is that it that statement doesn't necessarily go along with the research. And so, I feel hesitant, and I like, even, I just feel like anyone who reads the research knows that for, can find that there's research that shows that these, from a speech therapy perspective, these therapy sessions that our clients go through, these procedures, for those who are looking for it, a lot of times is really beneficial, and helps improve their safety, helps improve their emotional well-being, so many elements of this. And so, with a statement like that being blatantly told that people are discouraged from that just doesn't go with what the research is showing.
And I think the more difficult part that I get to when I read the handbook is the very next section says some children, youth, and adults are prescribed hormone therapy by a licensed medical professional to ease gender dysphoria or reduce suicidal thoughts. Before a person begins such therapy, it is important that he or she, or parents of a minor, understand the potential risks and benefits. If the members are not attempting to transition to the opposite gender and are worthy, they may receive church callings, temple recommends, and temple ordinances. So my hypothecation here, and maybe because we are still just inches into the weeds, if the church is okay with prescribing HRT, hormone replacement therapies, in an effort to reduce or eliminate gender dysphoria or suicidal thoughts, in your clinical opinions, how does speech therapy align with hormonal therapy? I would think that speech therapy isn't being used to alter a gender or change a gender. Am I wrong there? Is there something I'm missing?
You are not missing anything, Kyle. I think that one of the problems that we need to deal with in this situation is that ASHA, which is our national organization, has not done a great job defining the necessity of these services. Because there's not something physically wrong with an individual, you don't have a disorder when you are transgender. There's nothing wrong with you. It's described in our literature as a difference. You have a difference between your presentation and what your body is having you do, and with your voice. And so that difference then in our description of scope of practices doesn't lend itself to saying, no, really, this is totally necessary. This is critical. You break your leg, you get a cast. You have a stroke, you get some therapy to to improve the thinking and the language that's coming out of your mouth. But it doesn't have that same implication when it's a difference versus a disorder. And I think that has played into this situation to some degree. And as a profession, we need to fix that. We need to work with that in order to establish why this is critically important and medically necessary for our clients and their safety and health.
How does the community do that? How do we as a listening audience? I know obviously ASHA is a not a familiar organization or territory for the general public, but what can a listener do? Is there how can we help advocate for clinicians to best help your clientele?
Write some letters. And we need, as professionals, to get ourselves together and organized and put forward some recommendations for changes to language that appear in our national organization materials. As an organization, ASHA is tremendously supportive of the need to provide this service, to do it well, to do it appropriately, to research in it, etc. It's just that our documents don't necessarily use the language that allows other organizations to recognize that this is an expected and necessary part of what we do. So, we need to coalesce.
I 100% agree with everything, but I mean, per usual. But one thing I think that this really helps, I think, bring awareness to, Kyle, is just how many barriers trans individuals have to receiving quality care, right? And so one awesome thing about university clinics is a lot of times they subsidize, these services. And so if you think about, let's just, think about a trans individual and, they may be, paying for, hormone replacement therapy. Maybe they're seeing, some other medical professionals. And so ours is just another bill on top of it. And so, one way that universities can really support this community and why this matter is so important is because BYU had the opportunity to serve people in need, full stop. They had the opportunity to show love and to be Christ-like, to go forth and serve to a community that could really benefit from it. And at the end of the day, they decided not to, And again, I love BYU. I love the ComD department. I went to BYU. I've spoken to BYU students, their National Speech Language Hearing Association. They were a phenomenal group and they all wanted to learn and they had the motivation. And so I agree with Wendy too, where I know that the people within this department are beautiful, are amazing. I respect them so much. It just seems like a missed opportunity for BYU to help a community that could benefit from it.
I like that. All right, let's switch gears. I'll take you off the hot seat for just a little bit and then give you an opportunity to be clinical professionals. We have, I'm certain, transgender members in our audience who are listening to this episode, wondering how they could benefit from this service or how they could be benefited by this best practice. What would be your advice to that person who's listening, stepping into this space for the very first time?
Wendy, go ahead again. I like hearing what you have to say first.
I like what you have to say too, RJ. I think, and I apologize. I may have missed a little bit of your question, Kyle. I think it relates to someone's in this position. What do they do? Well, you know what? Do your research. Look for clinics that particularly list this type of service as something that they are familiar with, that they do engage in. And talk to the practitioner. There's so much to be said. It's not unlike psych, and RJ, you can agree or not with that, but that we do establish a relationship with our clients. And you've got to find somebody that you feel confident with and that you are comfortable with and that you think is going to help you be your best self. That's our job every day. So I say do your research. Call around. Don't accept the first thing that comes down the pike. Find where you click. There's a right therapist for you. Keep looking. And be really careful about too many YouTube videos that may not be demonstrating best practice.
True. Wait, what did I say on my mission? I would like to testify what my companion just said. I would say that in Spanish, but I want to testify what Wendy just said. I 100% agree because, when I see clients, I always tell them that anyone who's interested in seeing me gets a 15-minute consultation. And it's exactly for that same reason, to see if we click, for them to ask me questions, for me to share my qualifications. Because at the end of the day, what I tell my clients, Kyle, is that I'm knowledgeable in the tools to help you get your voice to where you want it to be. But my clients are the experts in their own voice. They've been the ones that have lived with their voice since birth. And so it's more, me working with them to help them have the autonomy and the independence in order to get their voice to where they want it to be. And so it's really, it's this rewarding thing, and it shouldn't be something where the clinician is telling it shouldn't be like, me telling the client everything they have to do. It should be, this collaborative experience. And so that's what I would tell these individuals to look for, is look for a clinician who has that, training, but who can also empower you, and where you can have this very collaborative relationship.
I like that.
Good point.
And I appreciate both perspectives. What about to an active Latter-day Saint family? This topic, obviously, today's episode deals specifically with a Latter-day Saint population who is Orthodox in their tradition and faith. What would your advice or recommendation be to parents who are, I would say, traditional, conservative, Orthodox Latter-day Saints who have a transgender child and see this? Should they see this as an option? Should they be worried? Is this a slippery slope to introduction to speech therapy, which then leads to gender reassignment surgery? Is that something that they should be worried about? Is that part of this discussion at all?
That's a really good question. Let me give you an analogy. When my oldest son, who happens to be on the autism spectrum, was in 3rd grade, his behavior in the classroom resulted in his being yelled at more than anything else. He wasn't learning. She was just mostly getting in trouble all the time. And I was 100% against medicating him for his ADHD on top of the autism spectrum disorder. And that wasn't my philosophy. But when I looked at the situation from his perspective, giving him the medication would allow him to have more positive interactions all day long, which meant that his future would change very dramatically. He would have different relationships, more opportunities to learn. And so my attitude towards medicating that became a whole lot less important than my desire to have him have a much more positive experience. And for kids in families, perhaps looking at things from that perspective, what do I do to support my child having a more positive experience every day in their life until they can make those decisions for themselves, might be the way to approach that question.
What about you, RJ?
I, as someone who has worked with trans youth, at the end of the day, the work that we're doing is to help people feel, more empowered by their voice, right? And I'm thinking of one specific client that I worked with, Kyle, and they wanted the ability to have both a masculine and a feminine voice, and to change based off of, however they felt. And we worked with that. And there was nothing permanent about that. And I also think parents should be trusting of clinicians. And I advise the parents on what would happen if this client began taking testosterone and, stuff like that. And this parent at the time said, I don't want anything permanent. And so I explained what would happen through voice services, and that, the client, their child would have the ability to modulate, to change as much as they wanted, but that's on a different playing field than HRT. And so I think that at the end of the day, voice stuff is, or I don't like saying stuff, but these voice services are meant as a way to empower individuals. And I think that a call to a clinician can really help solve that.
Thank you. And we want to welcome Lisa into the broadcast. Welcome, Lisa.
Hi. Hi,
Good to
all
have
of
you
you.
here as
Kyle,
well.
RJ, Wendy, nice to see you.
You too.
And as we mentioned earlier in the podcast, Lisa is a clinician at Flourish Therapy in Provo. And we've discussed a wide variety of topics throughout this episode, Lisa. We're talking about Latter-day Saint families and the orthodox nature of their belief. In your experience, especially working with this population and working in the heart of the lion's den in Provo, what would your advice be to Latter-day Saint families as they approach this intersection? They see that the BYU administration thinks that speech therapy is a threat to the handbook. In your professional opinion, is it a threat to survivability or thriving for the transgender, gender fluid, non-binary client that you serve?
Well, if we're talking about young people in family context, what we know is that they do much better when parents are very interested in their own experience of identity, their own experience of what's happening to them gender-wise. And so their thriving is best supported when parents listen. When parents start from a sense of we know what gender is and we know how it relates to who you are, young people tend to do a lot worse. And when parents start from a place of, gosh, I thought I knew, but I'm really open to what you have to share, what you have to tell me, young people do better. We know that transgender young people or non-binary young people, they have a much harder road to hoe to find out, to belong, to feel like they are wanted in society, to feel like that they have something to contribute to the future communities that they'll be part of. This is part of the young person's daily concern. And these are all harder for them, which helps explain why there is such a greater risk of suicidal ideation among them, because their future is not, the mentors are fewer, their opportunities for engagement in future professions and future entertainments and future, all of the ways that we expect young people to want to participate in their futures, they have less possibilities in front of them. And so they have more suicidal risk. And so if parents, if LDS parents in particular will say, gosh, we don't know what your future looks like. Please tell us what your best future looks like. Please tell us what you most wish for, what you would like your life to look like. Young people have the best chance of surviving and thriving. And that involves various kinds of transitioning. Good research tells us that young people, their suicidal ideation goes down when we say, pay attention to them. When we listen to what they would like to be known as or how they would like to present themselves, their suicidal risk goes down. One of the most interesting studies says that people before transitioning think of suicide, 67% of them are dealing with suicidal risk. And post-transitioning, to the extent that's meaningful to them, 3% of them are dealing with suicidal risk. This is huge. As I was telling somebody just today, any program we have that reduces suicidal risk by 3 to 5% is worth millions of dollars of investment. And this paying attention to what young people feel and think and what their interest in transitioning might be has a huge impact.
Mm-hmm.
Kyle, can I just add a comment too?
Yeah, go ahead, please.
I really wanted to emphasize that, so the World Professional Association for Transgender Health has something called Standards of Care. And in it, they really advocate for interdisciplinary care. And so the work that Lisa's doing, like with a lot of my clients, I ask if they're seeing they're seeing a therapist. I recommend everyone sees a therapist. I have a therapist. And so it really does I like just going back to our work as speech language pathologists. We're not doing this in isolation, right? Like I could not do it without people like Lisa who were helping my clients with their stuff. And I'm sure, and I even have a client right now where my client doesn't feel comfortable like practicing their voice with anyone. I'm like, well, practice with your therapist. And it's those small steps where they can feel vulnerable and where they can feel comfortable to communicate. And so I just really want to recognize the interdisciplinary collaboration that happens between us.
Agree.
I think that's a great point. All right, I'll put you on the spot one more time. We'll go around the horn. I just want, so we've spoken to the closeted or the just venturing out, transgender, non-binary, gender fluid person. We spoke to their parents. If you had the opportunity to sit down with BYU administration, the board of trustees, with members of religious or faith communities, what would your message be to them as clinicians knowing clinical best practices, but more importantly, being able to work with this population hand in hand? What would your advice be to those religious communities? And if it is different, specifically BYU?
Okay,
I
jump in.
think Wendy's up.
Yeah,
We went around.
I'll jump in the weeds. Okay, so I would say BYU, you are doing such a fantastic job turning out qualified speech language pathologists who contribute so much to the community. Why would you limit their ability to treat all of the communities that we should be involved in? Why would you do that? That's basically what I want to say.
Lisa, go next. I'll wait.
Well, in addition to harming and limiting these students who are learning how to do evidence-based work and making it so that they are not useful in the world, and also increasing the reputation of BYU in the helping professions as perhaps turning out limited students, I think it's actually also harmful to the spirituality of the transgender students at BYU. The message that they're receiving is that what feels to them like it's very much connected with their ability to communicate, to participate, to be fully and wholly themselves as children of God is being crushed. For many transgender people, the thing that reveals them to others as not yet fully integrated is their voice, and that they feel like they, and I'm sure this has already been discussed before I got here, that is the aspect of their expression that often is the least authentic to them. And so it limits their ability to participate in careers, it limits their ability to participate in relationships socially, it limits their ability to participate in discussions and connect with others spiritually, and as well as all the other ways. And I think if we could do a quantitative assessment of how transgender people feel and experience themselves and participate spiritually as well as socially and academically, we would find that they have been harmed by being denied these services.
And these other comments are phenomenal. I don't know. Just to piggyback off of what everyone says, I think that at the heart of the gospel of Jesus Christ is one's ability to communicate with deity, with loved ones, with family, and by restricting this access to children of God, we're restricting their ability to experience life authentically and wholly. And I can't really think of anything. I just feel like that's something that would be very detrimental. I can't imagine if I didn't have the ability to communicate my authentic, in an authentic way. And so, to BYU, I would ask them to consider the importance that vocalizing and that communication is in their life, and think about how that would feel if they had that opportunity taken away as they reassess the situation.
Yeah, I like that. All right, I'm going to put you on the spot for the very last time.
Famous last words.
I know.
I've heard that before.
You opened the door to it, and so I figured we'll just kick it right down and we'll discuss it. But I want to talk a little bit about accreditation. So Lisa, you were a graduate of BYU. RJ, you also attended BYU. Wendy, you and I did not. I had a scholarship, but I didn't go. So you and I, we graduated with honors elsewhere. But I wanted to bring in Elder Holland's speech to the faculty just a couple months ago, and just an excerpt of what he said there in terms of accreditation. And then I just want to just pick your brain for just a second, really not throwing you under the bus at all, but I really just do want to discuss accreditation, because we brought up ASHA and what that means for the university. So
it seems clear to me in my 73 years of loving it that BYU will become an educational Mount Everest only to the degree it embraces its uniqueness, its singularity. We could mimic every other university in this world until we get a bloody nose in the effort. And that world would still say, BYU who? No, we must have the will to be different, to stand alone if necessary, being a university second to none in its role primarily as an undergraduate teaching institution that is unequivocally true to the gospel of the Lord Jesus Christ. If at a future time that mission means foregoing some professional affiliations and certifications, then so be it. There may come a day when the price we are asked to pay for such association is simply too high, too inconsistent with who we are. No one wants it to come to that, least of all me. But if it does, we will pursue our own destiny.
All right. So I'm wondering what it looks like to pursue your own destiny. What would it take? And I'm not saying that we run pitchforks, but President Holland has proposed that there may come a time where BYU stands alone and in solidarity to their doctrine only. So maybe a multi-thronged question. What does that do for faculty and staff at BYU? What does that do in terms of accreditation? What message does that send? And the message is eliminating 3 transgender clients from services at the BYU Clinic. What message does that send to those clinicians, knowing that if BYU loses accreditation, or if BYU is willing to discriminate this way, do other industry leaders, industry professionals, employers see that as a negative to a BYU graduate? I'm really just curious what the ramifications are, and if we take Holland at his word, what does that really mean for a BYU graduate? Lisa, you and RJ both hold BYU diplomas. What does that mean to you?
Well, I want to say first that I hope BYU does have a unique approach. That is an approach that believes in every student and every future client of every health provider student as a child of God, entitled to personal revelation, for example, for their own life, and that BYU, I would hope, would stand for believing in that, and believing that we don't have all the answers yet. And so we can't start from a place of putting people in boxes, but that we start from a place of really believing in them. That's what I wish BYU would stand for. I'll start there.
And going off of that, Lisa, I beautifully stated. And first of all, I don't hold a diploma from BYU. I was there for 2 semesters, so I didn't get into their undergrad program. Like, it was really hard. So I graduated from Utah State, but it was fine. Great experience. But I think, like, piggybacking off of Lisa, like, BYU is in such a unique position in that it, at its core, it should be embracing the divine potential of all the clients, right? If I had gone there for my master's, I can't imagine the amount of, I don't know, maybe like this hope and this love that would be, that would permeate the walls. And so I feel like BYU really could capitalize on that and help their students see the potential and help them see these clients as their siblings and God. And I can't speak on accreditation, but I think my one concern for the future of this is that it will limit the diversity of applicants that would apply to BYU's communication disorders program. Because as a former graduate student, we look into that when we're looking into schools to apply for. We wonder how they view cultural diversity, how they view people from different backgrounds. And I worry that BYU would lose the opportunity of learning from people of different backgrounds.
I'm not in a position to comment. I can't speak for the accreditors. I don't know what the future would hold for programs who do not embrace the entirety of humanity. We are all human. It is a human right to communicate. I think it does raise a flag if this is not an honored right to communicate in this group, then what happens in others? But I have no leg to stand on in terms of criticizing what may happen in the future or second guessing what the students may think, whether they're trying to come into that program or leaving from it. It's a really tough one. I don't think we know what the future holds. I just don't want to go to a place where human rights are not respected.
I think that's very, very fair. And I think a variety of really great responses to that question. We talked about it earlier. I just wanted to bring this up. ASHA is in particular, the accrediting board that is over the clinic. I do know that BYU is up for recertification, reaccreditation. And as you brought up, Wendy, earlier in the episode, it does take community involvement, and it takes the public being vocal as well. And I would invite our listening audience, if you do have a concern about what transpired at BYU, if you want to see certain services offered to these populations, I do recommend and invite you to visit and reach out to ASHA. ASHA.org is where you can find the accrediting board. And I think as a general public, it would be our responsibility to make our voices heard as well, and become more familiar with topics just like this. What didn't we cover, just as we wrap, that you think we should have covered? Last pieces of advice, or something that you think the audience should know before we wrap up and leave?
Hang in there. There are people that care.
I would just like to say I don't like to see the university becoming more Pharisaic in how it's seen, viewed, and experienced. I wish the university Godspeed in its mission to the mission of Christ that he stated to open the prison doors, to let captives free, to give sight to the blind, and to move people forward to become whole people. I think this is an essential part of it.
And I guess just to round us all out, I really wanted to thank those people who are fighting from the inside. I can't imagine the difficulty that it must be. You are anonymous, but we see you, we thank you, but also don't forget to take care of yourself.
Great.
Really important,
Amen.
RJ. Thanks.
Totally agree.
Thank you to each of you. RJ, for all of your great work throughout the queer community in particular, that the good that you do, each of you individually and invisibly as well. The unsung heroes are sitting here, in my opinion. But thank you, Wendy. Thank you for your work. In Lisa's territory, the heart of the lion's den, but not only just in Provo, but your work throughout the United States and in this space. And Lisa, for your tireless Mother Teresa dedication to the LGBTQ community.
Rewind.
In and out of Mormonism. But I think you walk on water, which is...
I'll tell my kids that.
They'll agree. Thank you to each of you.
Thank you, Kyle, Wade. Thank you so much for the work that you do.
Kyle.
I think that, emotional labor is seen. Unsung heroes. You're one of them.
I firmly believe in visibility and shining light in some of these darkest corners. Without that light, sunshine is the very best disinfectant. And without that light, these issues remain stagnant. And I appreciate those who came to me from BYU saying this is what's happening to a community of people that we love. And this shouldn't happen any longer. And this shouldn't be something that we're talking about in 2022. So thank you to each of you for your respective opportunities to serve this community. For each of you who are listening and watching on this podcast episode, we invite you to participate. We invite you to take hold of the torch in your own area. Reach out to these industry professionals, reach out to these accrediting boards, reach out to the university, reach out into those spaces where your voice could and will be heard, and let them know that gender affirming opportunities are a rising tide lifts all ships, and we need everyone to be happy and to thrive. Again, I want to thank each of our guests today. I want to thank you who have participated. This has been busy in terms of number episode. We've maintained over 300 people watching this episode throughout the hour, which is super incredible for a midday podcast. And so I anticipate that this will spread. For those of you who did watch this or are still watching it, we invite you to share this episode. Even leave a comment and let us know what you thought, perhaps even a question you might have or something that you learned from this episode. It'll help expand and spread the reach of podcast episodes just like this. To the audience, or to the people, to our guests today, again, thank you. I appreciate all of your willingness to serve this community, and again, the dedication that you have put into your practices. We will meet again, hopefully under better circumstances, with another story or another opportunity right here on Latter Gay Stories.
Thank you.